Hi, my name is Dr. Joshua Kays. I'm a surgical oncologist and I work with Franciscan Physician Network. Well, I grew up on a farm, always working with my hands, helping fix things, and I always knew I liked to build and use my hands and wanted to do something related in a career. I was actually getting ready to apply to engineering programs at college when I tore my ACL and MCL playing basketball. So going through that whole process, going through the surgery and the recovery, I just realized, wow, surgeons do all the things I like to do, they just do it on the body. When my patients come to me for the first time, they should expect to find someone who's open and listening, someone who wants to partner with them in their care. I think a big part of my role is to educate patients and their families on the disease, on what it means and what's going to happen next, not just tell them. Make sure they're on board, because it's really about being a team. So, I can only do so much. The patient has to do part of it as well. So the area of my work I'm most passionate about really is cancer care. One of the reasons I chose to do extra training in cancer surgery is to learn the nuances, to learn the fine points. And you become more than just a hammer looking for a nail. You'll learn all the different areas. Surgery is not always the right option for patients. It's not always the first option. And I think, that's what I love about treating cancer, is everybody's a little bit different and everybody needs to be treated different. And every patient has their own set of challenges, and that's a different puzzle for me to put together and unlock so that patient can have the best outcome they can have. When I'm not in the office, I try to spend as much time as I can with my family. I have 2 young girls and a wife. We like to travel as much as we can, spend time with family. Personally, I grew up playing a lot of sports. Don't play a whole lot anymore, but I do still like to get out and golf a little bit. If there's one piece of advice I could give to my patients, it's to stay optimistic. Especially with the cancers I tend to treat, they typically have poorer outcomes, but we are making progress all the time. There's new technologies, new treatments coming out all the time. And I truly believe one of the biggest differences in how a patient does is their attitude.